Hello, thanks for joining us. Coming to you live from Arirang's News Center in Seoul, I'm Shin Se-min. We are coming on the air to bring you live coverage of a briefing from South Korea's health authorities for the latest update on the coronavirus outbreak here in the nation. But before that, we're going to cut live to some of the latest information that we have on our news lineup. We start with the COVID-19 outbreak rekindling a long, simmering diplomatic row between South Korea and Japan. Now, both Seoul and Tokyo, starting today, will have a tightened border control on all travelers from and to each side. It's the first time most of the air routes between the two neighboring countries are being halted since they were first connected 70 years ago. Our Kim Hyo-sun tells us more.
The South Korean government is imposing stronger entry restrictions on Japanese nationals entering the country starting Monday. The move, which comes immediately after Tokyo's stronger restrictions on South Koreans, includes a 3-stage screening scheme. It's also suspending visas and visa waivers for Japanese nationals. Currently, Japanese visitors can stay in Korea for 90 days without visa. Seoul says it will not issue visas for Japanese nationals unless they submit a health document which states whether they have any COVID-19 symptoms. As of Monday midnight, the Japanese government also suspended the 90-day visa-free entry program for South Koreans, while adopting a 14-day self-quarantine for those flying in from South Korea. This means South Koreans need to get visas in order to travel to Japan, which the Japanese embassy in Seoul explained would be time-consuming. Seoul describes such move as, quote, unfair and unscientific. Japan is among more than 100 countries that have imposed curbs on travelers from South Korea. Seoul's foreign ministry explained that so far, nearly 1,500 South Koreans have been quarantined in countries, including China and Vietnam. Kim Hyo-sun, Arirang News.
In moments' time, we will be cutting over to government complex in Sejong, where the Central Disaster and Safety Countermeasure Headquarters for the latest outbreak, the latest information on the coronavirus outbreak here in the nation. In moments' time, we will be cutting over to that scene, and we will also be providing you a simultaneous coverage in English. Now let's take it over to that.
And we are looking over measures to minimize the fatalities of those with severe symptoms. And the last week was the most difficult times. And in Daegu, we had a lot of proceedings there. According to the new guidelines provided by the headquarters, we have provided the live treatment centers for tailoring the needs for those with the minor symptoms. And we have exerted our full efforts. And the testings and the screenings for the Shincheonji followers have been nearing the end, so that we are expanding our screening procedures for the people in the Daegu. And we have also classified the patients into severity of symptoms. And we are also providing via phone call some consultations on their health conditions. On the 2nd of March, after we opened the first live treatment center, there are 10 centers of such currently running, and about 1,602 people have been admitted to these centers. Today, we will be opening new centers in Gumi, which was used as the LG Display's HR center, and tomorrow we will be opening another service facility in near Gyeongju, which will accommodate about 3,000 more people. And by the end of this week, we will expand our live treatment centers to accommodate over 4,000 people. And we also designate comprehensive hospitals for treatment of the COVID-19 confirmed cases. And we will be transferring those patients to those designated hospitals. In Daegu has been witnessing a lack of the number of hospital beds. And in order to overcome this, about 700 people out of the 2,000 people who who have been confirmed have been moved to other regions, including Yeongju, Sangju, aside from the Daegu city. And we are currently controlling this through our headquarters. And about 78 institutions have been provided with our coordination. As of yesterday in Daegu, about 6,600 people are in quarantine and are under treatment, and about 2,000 of them are hospitalized, and another 1,000 of them are waiting to be hospitalized at homes. And the daily increase of the confirmed cases is currently decreasing, and we are witnessing an increase in the number of hospitalization as we have expanded the number of live treatment centers. And especially yesterday, among those who have been admitted to the live treatment centers, 36 have been tested negative and have been discharged following full recovery. And in the Gyeongbuk region as well, we are witnessing an increase of those who are being discharged after full recovery. So we are seeing signs of the outbreak dwindling, but we still do see an outbreak continuing. So I believe that this is a very moment that the central government needs to exert our full efforts. And next, let me brief you on the quarantine measures put forth in Gyeongsangbuk-do province. In Gyeongsangbuk-do province, there are 1,360 people who are on quarantine, and about 60 people are hospitalized. And among the over 1,000 people who have been confirmed, about 400 confirmed cases have been witnessed in areas that are located in the vicinity of Daegu. The outbreak concentrated on sanatoriums as well as group services where the elderlies are being administered. And to this, the headquarters has designated, and we are increasing our consultations with the Gyeongbuk region and the Gyeongsan city, and we are aiming to provide them with our utmost support. First of all, 7 of our staff have been dispatched to Gyeongsan region, and they have been engaging in epidemiological surveys as well as being identifying the outbreaks. And about 200 people have been dispatched to the region as for medical staff, and an additional of 100 more public doctors will be dispatched to the scene. And 11 nurse aides have been designated and dispatched to this region to accommodate the caring for the elderly people. A total of 6 hospitals, including the Pohang Medical Center, have secured over 243 hospital beds, and we have agreed to increase the number of negative pressure rooms. And we are providing over 6,800 protective gears, and we provided a numerous number of protective face masks to the Gyeongsan region as well. In order to have effective monitoring and quarantine of these confirmed cases, we are running the live treatment centers, and we will be increasing those centers upon increased needs. In today's meeting, we have reported on the international outbreak of the COVID-19. As of 8th of March, a total of 91 countries are witnessing the outbreak, with over 930,000 cases confirmed so far. The majority comes from China, and in Europe, the majority counts for Italy, and also in the Middle East, Iran. Also, other countries have witnessed over 5,000, and in the U.S., more than 500 people have been confirmed positive. As for Japan, it is currently not carrying out relative epidemiological surveys, so we are on concerns of more community spread. And in Italy, it has closed the schools and the movements, and they have carried out a lockdown in the northern Italy, including Lombardy. And in Italy, I believe that the first case was spotted after community transmission was carried out. And according to the updates by the WHO, we believe that there will be additional increase in Italy. And as of the U.S., 9 states, including New York, Washington, and California, have designated a state of emergency. And to this, the CDC headquarters here in Korea, considering the international outbreak of the virus, we believe that we need to provide entry restrictions for those who are coming into Korea, and therefore we will be expanding the screening process for those who are flying into South Korea, and we highlight the importance of international cooperation. And recently, we are, of course, witnessing a soft and slow dwindling in the number of new infected cases. However, we are still yet early to say that we have been overcoming the disease. And in Daegu, we are still witnessing cluster infections, especially centering around the closed-door meetings and social gatherings. Aside from Daegu and Gyeongbu regions, of course, the spread is not that rapid, but we are still witnessing sporadic outbreaks, so we believe that we cannot put our guards down yet. And we believe that this is the moment that we need to be in full gear to reduce fully the increase of the confirmed cases. The central government will intensify our quarantine measures, and we ask the local governments to carry out quarantine measures and securing of hospital beds and the relative epidemiological surveys so that we can curb the further spread of the virus. And I also advise all of the public to comply with personal sanitary measures, including washing of your hands thoroughly and coughing etiquettes. And please do refrain from going to outdoor activities and group gatherings, and keep social distancing. And especially these new outbreaks, infectious diseases, occur regardless of religion and boundaries, national boundaries, so we need to effectively counter the disease with a sense of solidarity and unity. We need to cooperate fully in order to overcome the outbreak of the disease. We would like to extend our gratitude to the public's sense of high citizenship that you have shown, and thank you very much.
지금부터 질의응답 시간을 가지겠습니다. 배석자분들은 무대 위로.
There you have it. That was a government briefing given to the public by the Central Disaster and Safety Countermeasure Headquarters in the government complex of Sejong, as we just heard it. Just to give you a recap of some of the numbers that we just heard, South Korea currently has a total number of confirmed cases of coronavirus, with the number standing at 7,382 after adding over 240 confirmed cases overnight. And the death toll currently standing at 51, up by one more casualty overnight. Although the country continues to add newly confirmed cases by the day, the growth of daily confirmed patients are on the decline. Certainly a positive development here in the nation, but the South Korean government officials did not seem to lower their guards just yet, and said it's a bit early to be relieved, as it is continuously seeing some sporadic outbreak of the coronavirus here in the nation. But with that positive development, we are going to end this newscast for the hour. But we'll be back with the latest on the coronavirus outbreak and much more in our next news lineup coming up at noon Korea time. That will be less than 1 hour from now. Thank you for watching, and goodbye.